The factors that can affect snoring includes any obstruction along the upper respiratory tract. This includes turbinate enlargement, structural deviation of the septum, large tonsils, a floppy palate, and a situation where there are diseases like colds, flus, allergic rhinitis can also make snoring worse. Lack of sleep, the use of alcohol, sedatives will also aggravate the problem. Snoring by itself is just a social issue. It affects our spouse, our family members, and disturbs them in their sleep. But what we are concerned with is a condition called obstructive sleep apnea. As the name suggests, there is an obstruction to the airway during sleep, resulting in a cessation of breathing. And this, over a period of time, can lead to problems like hypertension, heart disease, heart attack, stroke, and even diabetes.